Which quiz is it that we're retaking again?
We are taking the exam from Tuesday. The one we did Tuesday. So you should be able to open it with a new password. Let's hope.
So it's exam 3, right? Or is it one of the...
It's the one we took Tuesday, so it should be on week 5.
It says exam 3.
Okay, thank you. So it should say the 12, 13, 14, 15. All right, let's try all lowercase repeat. Let's see if that works.
I'm sorry, my internet cut out. Was it the chapter 3 exam, or exam 3? Okay, thank you.
You're welcome. Has anybody opened that yet? Is it working? Got it. Okay. Okay, is everybody finished? Yes? All right, let's make sure we have everybody online here. Sam got off. Okay. All right, so what I want to do on the chat, if you would, I want to review those questions. It seemed like we had a little difficulty with that exam on Tuesday, so let's just go over it to make sure that we know it, so that when we have that final exam, we'll know what's going on. Okay. So everybody into chat, please. What's the approximate blood volume of an average 150-pound adult? Good. 5 liters. Okay. What percentage of a child's blood volume can cause a cardiac arrest if it's removed? What is it greater than? What percentage? What did you choose? Our choices were 2, 10, 75, or 20%. I still need one answer. All right, so it's 10%, guys. Prolonged crying also affects the white blood cells, white blood cell count, I should say, and the pH level of the blood. Is that true or false? Okay, it is true. Bilirubin is produced from the breakdown of which of the following? Was it red blood cells, white blood cells, platelets, or epithelial cells? Okay, yep, red blood cells. All right, what's the term for buildup of bilirubin in the blood and skin? Let me give you the answers. Jaundice, hematoma, anemia, or hemophilia. So it is jaundice. Remember, jaundice goes with bilirubin buildup in the liver, okay? That's what we test in infants. All right, a 16 gauge needle is the best to use for a draw on a child younger than 2 years old. True or false? False, correct. In the geriatric patient, what kind of body changes take place that affect the safety and effectiveness of a venipuncture? So was it a lack of collagen? Was it arthritis, diabetes, or stroke? Lack of collagen, correct. Okay, so the order of the draw. Should it be, let's see, this is a true and false question. Should it be clotted tubes, blood cultures, and anticoagulant tubes? Is that the order we do it? False, right. So the order should be blood cultures, anticoagulant tubes, and then the clotted tubes. Okay. Again, in the geriatric patient, this is a true or false. The tourniquet should be applied looser than normal and pressure should be applied to the site longer than normal. What do you think? So that one's true. What's the normal pH of the blood? Can you type it in? Anybody remember? Nice job, guys. Good. 7.35 to 7.45. Good. Which artery is the most commonly used for arterial blood gas collection? Is it radial, femoral, brachial, or ulnar? Good, radial. Okay, what test is most commonly used to assess the collateral circulation of the radial artery? So if we're going to do that, what are we going to test first? Is it modified Allen test, modified Brown test, modified radial test, or modified circulation test? Yep, Allen test, modified Allen test. Place the tourniquet 2 inches above the arterial puncture site. True or false? Can anybody tell me why that's false? Exactly. You don't use one. You don't use one because the arterial has a pulse of its own, right? All right, 5 minutes is the minimum amount of time that a phlebotomist should hold pressure on an arterial puncture site. True or false? Good. For an arterial puncture, the needle should be inserted at a 10-degree angle into the skin. True or false? Good, false. So it should be about a 30 to 45-degree angle, okay? A blood gas specimen that's not iced must be transported to the lab within what time frame? 5 to 10 minutes, 1 to 3, 24 hours, or 30? Okay, so 5 to 10. Okay. True or false? Timed specimens are most frequent collected to monitor medication levels. True. All right. Within what time period should a patient drink the glucose solution required for an OGTT? 5 minutes, 24 hours, 30 minutes, or 15? Okay, that one is 5 minutes. Okay, so they drink it and then they quickly go and have the test done. So 5 minutes is this one. Remember that. For a 3-hour glucose tolerance test, how many blood samples will be collected for a 3-hour? Okay, for a 3-hour, it is 4. Good, because there's a fasting one. A PCT has just collected a specimen to determine the patient's blood ammonia level. What action should the PCT take? Do we put it in a ice slurry, wrap it in aluminum foil, let specimen sit at room temperature, or place the specimen in a warmer? Good, ice slurry. The most common light-sensitive analyte is it bilirubin, lactic acid, ammonia levels, or, let me turn the page, or CBC? Bilirubin, that's right. All toxicology and drug screens need to have COC, CDC, CBC, or BOB. Right, chain of custody. A urine specimen is labeled after collection, before collection, on the lid, or by the patient. Okay, urine specimen is labeled after collection. What type of urine collection is best for pregnancy? First in the morning, random, catheterized, or timed? Okay. A 72-hour stool specimen is collected to determine protein, culture, occult blood, or fat. Okay, fat, good. What type of fecal testing is used to screen for colorectal cancer? Again, is it culture, fecal fat, O&P, or occult blood? Very good. You guys are putting it down before I even give you the answers. Good. All right. Occult blood is that one. What specimen sample is used to check the success of vasectomy procedure? Semen, blood, urine, or saliva? Okay. And what type of specimen is tested in the diagnosis of meningitis? Cerebral spinal fluid, pleural fluid, synovial fluid, or amniotic fluid? Good. Spinal fluid. And then what specimen is collected to diagnose whooping cough, croup, and pneumonia? An NP swab, urine, throat swab, or dermal puncture? Yep, NP swab. All right, and then order of the draw, I'm just going to give it out here. So remember, it was going to be yellow first, light blue, glass red, red gray, green, lavender, and gray. All right, enough of that. Just wanted to make sure we reviewed that. Okay, let's move on. So I'm going to review real quick just the questions of chapter 16, and then we're going to move on. Can you guys see the screen yet? The Zoom slideshow. Can you see that? Okay. How many, again, use your chat room and let's do these real quick. We'll just flip through these. How many times should a tube of blood containing an anticoagulant be inverted? Yep, 5 to 10. All right. This one says, the label printer is broke and you must hand label, which is not required on the label. Date of collection, date of birth, patient name, or time of collection. All right, let's see this. Date of birth. So the date of birth, okay? Tubes must stay upright during transport for all but, which one of these? Okay, I think we all have the same answer. So the answer that it does not is slows down metabolic process, okay? Which of the following tests is the most affected by glycolysis in the tube after collection? Good. Glucose. What is glycolysis? Okay. Breakdown of sugar. Very good. All right. What is the maximum time to deliver a specimen to the lab? "45 minutes." All right. So then the CLSI states that the max time before cells separate from plasma or serum is I wasn't sure, Sydney, if you were going to give me both those answers. Good job. 2 hours. All right. What anticoagulant tube can be sustained at room temperature for 24 hours without separating of cells and plasma? Good. Sodium fluoride. All right. Blood smears from whole blood must be made from the tube within what time period? Let's see. So it's 1 hour. So blood smears from whole blood must be made from the tube within 1 hour, okay? Which sample does not need to be protected from light? See if you guys remember. Good. Calcium. All right. All right. A unique identifying number used for cataloging samples in the lab is referred to as what kind of number? Very good. Assess the number. All right. Should be almost done, this part. All right. Before dividing that 24-hour urine that was collected into different aliquots, what must be done with the sample first? So what are we going to do with it first? Very good. We're going to measure and record the volume before we start separating it out. All right. The phlebotomist had difficulty getting the EDTA tube for a CBC NSAID rate. So you've got 2 underfilled tubes. The phlebotomist should do what? Correct. We're going to reject it at the bedside and redraw it because we're not going to mix them together. Good. All right. So let's do a new share here. All right. So let's move on to chapter 17. Sorry about that. All right. Let me get it set up. All right, so this is about, well, that's not 17. It won't pick up. Where's 17? Huh. I can't get rid of 16. All right, I'm going to get rid of 16. All right, here we go. All right, so this is point of care testing. Point of care testing is literally you're going to be able to give people the results right there. Okay, so things like glucose test, you know, pregnancy test, cholesterol test, urine test with dipsticks, things like that. So you might be set up like at a health fair, and these are, you know, little tests that people are coming in to get checked, or this might be things that you're just doing quickly in the labs, et cetera. But these are all with immediate turnaround with the results, okay? So point of care testing refers to the performance of a test immediately after obtaining a sample, often in the same room with the patient. So it's called the point of care. POCT is also known as AST, which is alternate site testing. So you need to know those 2 words because the people use them the same, you know, some people use the same thing. So it's point of care testing, which is POCT, or it could also be called AST, which is alternate site testing. So it's more like bringing the laboratory to the patient, okay? The turnaround time for obtaining the test is shortened. It allows for a prompt medical attention and faster diagnosis and treatment, okay? And potentially decreased recovery time. So, okay, here's our first question. What does that mean? What, I can't see because this thing's in the way all the time. What's another name? Go ahead and chat me. Yes, so alternate site testing, or AST. Okay. Advantages of the point of care testing. Most tests performed as POCT are tests waived by the Clinical Laboratory Improvement Act, so CLIA, okay? The FDA, so you need to know that the FDA decides which tests are waived. Essentially, feature of the CLIA wave test, testing equipment and procedures are very simple and accurate, and are accurate. Okay, so they make these tests have to be accurate. The machines have to be in good standing working order. Okay, but essentially, getting like, let's say, a glucose test, the measurement is accurate. In general, the POCT instruments are easy to use, okay? The training is very simple, and you guys have probably already used some of these at the hospital, or if not, you will be. And a variety of folks are going to be doing it. You know, phlebotomists, nurses, medical nursing assistants, et cetera, can do some of these tests after being trained. Which is necessary in a patient's home, but not necessarily at the hospital. So what do you guys think? I didn't talk about this, but what do you think if you were actually going to a patient's home versus being in the hospital? What do you think you need to have with you or have done or et cetera? Let's see what you came up with. All right, so exactly, carrying your cell phone. So if you're in somebody's home and you have an emergency, you have to have your phone with you, okay? In the hospital, you've got folks around, you can yell out for help, there's, you know, et cetera. But in the home, you have to have a cell phone. Do you remember which agency decides if a test is CLIA waived? Good, FDA. So they decide which test can be CLIA waived. Quality assurance is very important, and controls are essential for the use of these instruments. So you're going to be doing testing to make sure and calibrating the machines to make sure that they are running correctly. A lot of times, if you're not doing these tests, it can give us a negative test result, and then there could be negative consequences for those patients. Okay, so we need to make sure we're trained on these machines, but they're pretty simple. We need to make sure that we are calibrating them according to the factory specifications. Okay, here's some tests. Some normal tests. There's a BNP, which tests for cardiac enzymes. So these two are testing to see if somebody maybe had a heart attack. Okay. We can test for cholesterol. We can test for clotting, like with a PT, et cetera. Electrocardiograms, which we're not going to go over today. We're going to wait until we get into EKGs, but that's another one. Glucose monitoring, hemoglobin, and some chemistry panels are all point of care. All right, so hematology. Hematology is the most common hematology test performed as a POCT test. So hematology is the most common, okay? A simple, fast method to determine anemia using a handheld hemoglobin analyzer, okay? There's also hematocrit reading is sometimes used right at the bedside or in the clinical office. The test cards shown are for Chem8 panels. So we're going to do a basal or a basic metabolic panel. And then we can also do blood gases. So what I'm going to do here is stop for a second. Do a new share. Let's see. All right, so let's just kind of look at this. Hopefully I wasn't logged off on my Evolve account yet. And let's look at the hemoglobin. All right, so let's take a look at how we do this. Can you guys see that?
Hemoglobin test. Equipment needed for this procedure is as follows. A hemoglobin test may be performed to determine the amount of hemoglobin that is present in the blood and to help diagnose anemia. Use a skin puncture device as demonstrated in the video titled Capillary Collection on a Finger, wiping away the first drop of blood. Place the next drop of blood onto the chemical pad of the analysis stick or cuvette. Provide a gauze pad to the patient and ask her to apply pressure to the dermal site if able. Insert the hemoglobinometer cuvette into the machine. The results should be displayed in a short period of time, usually within a few seconds. Record the results according to facility protocol. Dispose of all contaminated supplies into a biohazard container.
So pretty simple, pretty simple. Okay. So that's your hemoglobin. Then you've got coagulation monitoring. It helps us determine if people have clotting disorders. Heparin therapy may be monitored, determining activated clotting times, so ACT. We might be looking at partial thromboplastin times, oral anticoagulant therapy using things like Coumadin or blood thinners. So we're kind of that's what coagulation testing would be monitoring, is all this kind of things, okay? All right, so let's do this little quiz here. A portable instrument for a simple, fast method of testing for anemia measures which of the following? Good. All right, so it would be the hemoglobin, okay? So a portable instrument, if we're testing for anemia, we're looking at hemoglobin. So that's what the test would be. All right, so now we have chemistry. Excuse me. This is probably the most common thing you're going to be testing with the bedside POCT stuff. Bedside glucose monitoring is the most common chemistry test done, okay? We test that all the time. Glucose is determined with a dermal puncture and a region strip. The specimen tested is whole blood, okay? The ancillary blood glucose test is performed at the bedside, most often for patients with diabetes. If you want to review that, that's in your book on page 261. Because different manufacturers have different kind of procedures for their machines, we have to make sure that we know how the machine works, what it's expecting, and we need to make sure that the machine and the test strips match, okay? We want to make sure that the machine has proper calibration and the controls are being done, because if not, we're going to get a false reading. So make sure, the biggest thing on this one is just making sure the strips that you have in your hand that come in the little tube are the strips for that machine. Okay, so to do this, we perform a routine capillary collection. Again, some manufacturers do not recommend wiping away the first drop of blood, so we have to decide what first of all, what your facility expects, but what that machine expects too. You're going to collect a blood drop directly onto the strip, cover appropriate area on the stick with a free falling drop of blood, okay? You're going to be careful not to touch the strip yourself or allow the patient's skin to touch it. So we want that to drip onto the strip. Read and record the results. Values that are outside the normal range are going to be reported immediately. So let's watch that. Let's go there. All right. I'm sure you guys have done these. If not, you will be doing these soon. If I can get there. All right.
Ancillary blood glucose test. Equipment needed for this procedure is as follows. An ancillary blood glucose test is used to measure the amount of sugar in the blood and can be used to help diagnose diabetes mellitus. Use a skin puncture device as demonstrated in the video titled Capillary Collection on a Finger, wiping away the first drop of blood. Holding the glucometer with a preloaded test strip and taking care not to touch the chemical pad, collect the sample onto the test strip. Do not allow the chemical pad of the test strip to touch the patient's skin, which could contaminate the test results. Once the test strip is activated with blood, the machine will begin an automatic countdown before displaying results. Apply a clean piece of gauze to the puncture site and ask the patient to assist if she is able. Discard the test strip and all blood-soiled supplies into a hazardous waste container. Check to see whether the patient has stopped bleeding and apply a bandage if necessary.
Your cell phone number?
Okay. Let me get off of here. Shoot.
Ancillary blood
Yeah,
glucose test.
Don't want to do it again. Sorry.
Equipment needed for this procedure is as follows.
Sorry, guys. It's got a mind of its own.
An ancillary blood glucose test is used to measure the amount.
All right. Let's go ahead and do the A1C while we're here, and then we'll talk about it. It's going to be easier, I think. All right, so then there's A1C, and then I'll tell you about this here.
Hemoglobin A1C test. Equipment needed for this procedure is as follows. A hemoglobin A1C test measures A1C, a protein related to an individual's average blood glucose level over a period of 4 to 6 weeks, and is used to measure the long-term effectiveness of diabetes therapy. Use a skin puncture device as demonstrated in the video titled Capillary Collection on a Finger, wiping away the first drop of blood. Use the capillary holder to capture the next drop of blood onto the glass capillary at the tip of the holder. Carefully insert the capillary holder into the reagent cartridge until the holder gently snaps into place. Insert the cartridge into the machine's barcode track and scan the barcode on the cartridge to begin the test. Place the cartridge into the machine compartment, removing the aluminum pull tab, and close the door. The results will display within several minutes. Dispose of all contaminated supplies into a biohazard container.
Okay. So that's the A1C. So let's move on and talk about that a little bit. So the A1C is hemoglobin, like I said. You're going to be analyzing to detect for, again, this is for diabetes. It monitors the long-term effectiveness of the person's diabetes therapy, be it medication, diet, etc. So they're testing to see how well the program that that person is on to control his diabetes is working, okay? Usually over a period of 4 to 6 weeks. So it's pretty simple testing too. All right, here's a little question for you. Bedside glucose testing is rare, true or false? Good, false. It's very common. All right, so then these are the cardiac enzymes that we're looking at. We're going to monitor these to see if we've had a possible heart attack or a myocardial infarction, okay? So things, if you see these terms, cardiac troponin T, that's what we're looking for to see if the person may have had a heart attack, okay? So these levels will rise within 4 hours after an acute MI. Results are ready in 15 minutes. So if we can get that result, we can help that person maybe survive the heart attack. Okay, so then we're also going to be involved in chemistry. We're looking for lipids. So essentially, we're doing cholesterol monitoring. Okay, cholesterol levels may be determined as part of a routine exam. It also, again, might be because somebody's on medications to lower their cholesterol. So we want to know how well those drugs are working. Blood is applied to a card and a color determination is made after the reaction takes place. Let's watch and see how that happens. All right, cholesterol testing.
Cholesterol test. A cholesterol screening is a common point-of-care test used to help diagnose the patient's risk for heart disease. Use a skin puncture device as demonstrated in the video titled Capillary Collection on a Finger, wiping away the first drop of blood. Next, using a capillary tube with plunger, collect a blood sample and fill to the black mark. Provide a gauze pad to the patient and ask her to apply pressure to the dermal site if able. To analyze the sample, depress the plunger to release the blood into the cassette sample well. Activate the cholesterol screening device according to manufacturer instructions. And load the cassette into the drawer of the machine. Press Run to begin the test, and results will display within a few seconds. Record the results according to facility protocol.
These tests, that poor lady keeps getting stuck. I feel sorry for her. Okay, so pretty simple again, machine. All right, then we've got chemistry, blood gases, and electrolytes. So several instruments are available for that. That we're looking at arterial blood gases, things like oxygen and carbon dioxide, and also the pH, right? And then some common electrolytes like sodium, potassium, calcium, chloride, and bicarbonate. All these instruments require careful calibration and more training than the other ones, which are a little bit more simpler, okay? Chemistry B type. So this is the BNP. This is also known as the brain natriuretic. It is a hormone, okay, and it's made by the heart in response to expansion of ventricular volume. So more or less, it is a quick way to differentiate between COPD or congestive heart failure. Okay, so if somebody is breathing and they have, distressed lung sounds and et cetera, this test will help us determine, is it a lung issue or is it a heart issue, more or less, okay? We have C-reactive protein, is inflammatory marker used for monitoring like inflammation in people who have things like autoimmune disorders or post-surgically. So elevated CRP is a risk factor for heart disease also. It may be indicator of a risk with LDL. So we do test that on the POCTs. All right, C-reactive protein tests for what? Does anybody remember? So it's going to look for C-reactive protein, looks for inflammation. Okay, so it's going to look for inflammation in people who might have some autoimmune disorders or post-surgically. Okay, so that's what C-reactive is. the number of tests that are waived by the CLIA are growing. So we're going to be able to do a lot more at the bedside or right there and get immediate results, which is kind of cool. We don't have to wait and send them all the way to the lab. So these machines are getting more widespread. Let's start talking a little bit more about cult blood. We've done this before. The stool specimen is placed on the card in the two windows. And then there's a developer put on there, okay, which is called stabilized peroxide reagent. It's added to the test, okay. Detection of occult blood in feces is used to diagnose things that are wrong with the digestive tract, like ulcers and cancer also for like colon cancer. So if there's blood detected, then there could be an issue. Of course, urinalysis, we've talked a lot about that. This is ones that we can do with a dipstick, okay? So we're going to use a dipstick to test things like pH, protein, if there's glucose in the urine, ketones, bilirubin, urobilinogen, blood, leukocytes, nitrates, etc. Okay, and we're also looking at the specific gravity. Before the test begins, the urine specimen must be at room temperature and thoroughly mixed. So we're going to look at the color change on the strip, and it's compared to the reference color that's on the bottle. The urine strip is briefly and completely immersed in the well-mixed fresh urine. After removal, excess urine is blotted from the side of the strip, and then you're going to compare the color change on the strip with the bottle, like I said. All right, let's see. I think I have a video on that one too. Pretty easy. All right, urinalysis. We got a couple more here. All right, let's just look on how we do this.
Urinalysis. Equipment needed for this procedure is as follows. Perform hand hygiene and don disposable gloves. Compare the container urine to the patient requisition to accurately identify the specimen. Label the specimen appropriately with patient identification, date, and time of collection. Transfer in aliquota the specimen, 10 to 12 milliliters of urine, into the conical tube. The specimen must be well mixed prior to analysis. Observe and record the urine color and clarity, noting whether the specimen is clear, slightly turbid, or cloudy. Note any significant findings according to the healthcare facility's policy. Prior to performing the urinalysis, become familiar with the various tests included on the urine analysis strip and the time required to obtain an accurate result. Test strips may be read anywhere from immediately to 60 to 120 seconds after dipping. Ensure that the container lid is sealed properly and invert it several times to mix. Remove the cap from the specimen tube and place it face up on the counter. Carefully dip the test strip into the urine specimen, immersing all areas. Remove the strip immediately. Do not allow the chemical pads to touch the sides of the tube. Hold the test strip horizontal and run the edge of the strip against the rim of the specimen tube, or touch the edge of the test strip to an absorbent paper towel to remove any excess urine. Do not blot the test strip. Note the time to the minute. Begin reading the various reagent pads at the specified time, comparing the color of the pad to the color on the back label. Be careful to not contaminate the jar by touching the test strip to the label. Carefully record the result of each reagent pad for any color change reaction per the facility's protocol. Dispose of the test strip into an appropriate biohazard waste container.
Okay. Somebody let me know, did we watch the cholesterol? Does anybody remember? I don't think we did. Let's go ahead and watch it.
Cholesterol test. A cholesterol screening is a common point-of-care test used to help diagnose the patient's risk for heart disease. Use a skin puncture device as demonstrated in the video titled Capillary Collection on a Finger, wiping away the first drop of blood. Next, using a capillary tube with plunger, collect a blood sample and fill to the black mark.
I think we did. Oh, well, we'll watch it again.
Provide a gauze pad to the patient and ask her to apply pressure to the dermal site if able. To analyze the sample.
All right, we did watch that one. Sorry, guys, I couldn't remember. All right, let's move on. Could not remember that one. All right. All right, so then there's also point of care where we're doing pregnancy tests or checking for some infectious diseases. So pregnancy tests, we're looking for HCG, which is a hormone produced by the placenta after implantation of the fertilized egg, okay? So if it is present in the urine and serum, and test kits are available. So we're not, you can do this by collecting blood or in a urine sample, okay? There's also other tests that can detect certain infectious diseases that you might run across. There's rapid group A strep, okay? Rapid group A strep. And this is a throat swab. The procedure usually requires extracting the sample to isolate that bacteria, followed by the addition of a reagents and a development of the color change. So it's kind of, you're still going to be using the, the canister to compare the colors. The test results are generally available within 3 to 5 minutes. That's pretty cool. And that is going to be one of our last videos, I believe. So let's go ahead and do that one real quick. Excuse me. All right. All right,
Rapid Group A Streptococcus test. Equipment needed for this procedure is as follows. Greet and identify the patient. Explain the procedure and answer any question the patient may have. Perform hand hygiene and assemble your equipment. Open the swab provided in the kit and obtain the specimen by performing a throat culture. Next, insert the swab completely into the well of the plastic tray. Break the small glass vial in the plastic reagent bottle and shake. Fill the well of the plastic tray with the reagent. Follow the manufacturer's directions and wait the allotted time, usually between 5 and 10 minutes. Read the results according to the kit's instructions by determining the color change in the reagent pad. Again, follow the manufacturer's instructions. Record the results. Discard the used test and swab in a biohazard container according to healthcare facility policy.
Okay. So that's the rapid group strep that we can do very quickly. All right. We can also test for RSV. This infects the airways. This is especially in children, very common. We would do an MP swab on that also. You could do a nasal wash, but MP swab's probably usually what we do. Again, we can look for influenza A and B, and now, of course, COVID. The test is performed on a specimen collected by a nasal swab, nasopharyngeal swab, nasal wash, or to aspirate the nasopharyngeal area. And you would do that with a suction. There's two main types of flu, A and B. The influenza A and B test detects both and distinguishes which is which, okay? A single sample can be used to run both of those tests. We've already, did we watch that one? Okay. H. pylori is bacterium found in the stomach. This is very common, and it is a very common cause of somebody having ulcers. Okay, so we test for that. It can be the antibodies to the bacterium can be detected with the test, and we use whole blood samples. We can test for mono, which again is a very common virus, Epstein-Barr virus. It causes sore throat, fever, swollen glands, and extreme fatigue. We can test for that. We can test for HIV HIV attacks the T helper cells in the immune system, and it causes acquired immune deficiency syndrome, AIDS. So we can test the whole blood. Now, the one thing I do want to say about this, and you do need to remember that, because I do know that I'm definitely sure that that's on one of your mock exams and your certification, is that the patient must provide written consent to have this test done. So we can't just because a doctor or somebody's ordered it, we can't do it without a written consent from that patient. All right, so that's the end of that. Okay. All right. So what I'd like to do now, since we've done all that, is I want to kind of review real quick for the quiz we're going to have on Tuesday. It's on chapter 16 and 17. Okay. I will upload this lecture so that you guys can review it. Remember, review the whole thing, or you can fast forward towards the end and find what we're doing right now. Okay. So again, I want you guys to chat me and let me know what you think. So if I were to ask you, I'm sorry, I have a frog. What, that unique identifying number that the lab uses, what is that number called? Is it that Assessment number, aliquot, laboratory, or safety number? A, B, C, or D? All right, right. Assessment. If I were to say, according to the CLSI, what is the maximum amount of time that may be allowed to elapse between collection of a blood sample and the separation of the cells from the plasma or serum? So we already reviewed these, but I want to make sure we do them again. 30 minutes, 2 hours, 12 hours, or 24 hours. Very good. B, 2 hours. So 2 hours is the the maximum amount of time that can go on between this blood sample and the separation of the cells from the plasma. Okay. Now, you remember this one. Before you divide that 24-hour urine sample until it's aliquots, what do you need to have done? Do you need to put it in the refrigerator, add an anticoagulant to the container, measure and record the volume, or mix it and then divide it in aliquots? Good, 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 good. All right, so what we need to do is measure and record the volume of that sample. Blood smears from EDTA specimens must be made within what time period after the collection so that it does not distort the cells, okay? Is it 30 minutes, 1 hour, 12 hours, or 24 hours? I think this one's a little tricky. So it's actually 1 hour, okay? 1 hour for the blood smears before it distorts the cells. That's all we've got. So we got to get it going within 1 hour. All right. How many times should tubes with additives be inverted after collection? None, 1 to 5, 5 to 10, what do you think? Five to 10, very good. The phlebotomist had difficulty getting those tubes filled, so they've got 2 that have halfway filled. What do? Do we mix the 2 together? Do we reject at the bedside and redraw? Do we take it to the lab to see if they're gonna take it? Or do we perform a dermal puncture? So we're gonna do reject it at the bedside. That's good. Yeah, we can't mix them together. All right, you guys know this one too, I know for sure. What is the term for metabolic breakdown of sugar? Glycolysis, glucagon, glucose, or glucosuria? So the metabolic breakdown of sugar within the cells is glycolysis. Glycolysis. A consent form is required to perform which one of these tests? HIV, CRP, RPR, or HBV? So HIV, CRP, RPR, or HBV? It's HIV. HIV. Okay. All right. According to the CLIA, what is the classification of tests in which the procedure is simple and erroneous results are unlikely? Is it waived level test, low level test, high level test, or high complexity? So think about what point of care testing is, okay? Point of care testing, I'll go ahead and give it to you guys. Point of care testing are waived, okay? Remember, they're waived level. So according to CLIA, the clarification of tests in which the procedure is simple is a waived test, okay? Blood levels of which of the following inhalants are increased in congestive heart failure? Is it BNP, PT, cardiac troponin, or APTT? This one might be a little tricky for you guys too. Yeah, it's a little tricky. I'm going to give you this one. It's BNP. Okay, so it's actually A. BNP is used to diagnose cardiac or congestive heart failure. Okay, congestive heart failure. Remember, it kind of determines if it's COPD or congestive heart failure. Sorry. So BNP, we're diagnosing congestive heart failure. What's another name for point of care testing? Is it FDA testing, CLIA testing, alternate site testing, or reference site testing? Good, C, very good. It's alternate site testing, or AST. What is the most common chemistry test performed? Is it glucose, CBC, potassium, or sodium? Most common chemistry test performed. What are you guys going to do a lot of out there? So it's glucose, okay? We're going to do a lot of glucose testing. It's the most common chemistry test. Which type of sample is used for an occult blood test? Feces, blood, throat swab, or urine? It'll be feces. Good. Which of the following is a bacterium found in the stomach? H. pylori, RSV, mononucleosis, or EBV? Whoops, I thought we lost Sam. So it's H. pylori. So that question was, which of the following bacterium is found in the stomach? It's H. pylori. Remember, it'll cause ulcers. Which of the following is a POCT used to screen for colon cancer and gastric ulcers? Is it occult blood, cardiac troponin, BNP, or PTT? It's occult blood. Very good. Okay. Which of the following agencies decide whether a given test is a CLIA wave test? FDA, CLIA, AMA, or OSHA? So it's FDA. They decide which of those tests are going to be a CLIA wave test. The other thing that's going to be on your quiz is another, just putting, we're always going to have that order of the draw. So make sure you know the order of the draw. Okay. All right. Let's do one more thing for me. All right. All right, guys, go ahead and pull up your Kahoot. However you do that, we're going to play a real quick game. Can you see the pin? You should be able to enter that pin, and we'll start here in about 1 minute. Okay, let's start. It's only 20 questions, and this is on, well, let's get going here and I'll show you. This is an NHA processing, so let's see what we know. Okay, so which results should you distribute first? Stat, CBC, good. So what this means, what this question is saying is that person, you've taken, and everybody has an amount of blood that you can take and then you have to stop. And this part, you're at that level. What do you do? So, you're at the limit of what you can take out of that guy's arm again. What do you do? So you contact the patient's endocrinologist. Good. Right. So when we're doing the centrifuge, remember, place tubes of equal volume across from each other so it balances the machine out. Rapid heartbeat. Okay, so their blood sugar is low. Patient identification number. Okay, so when we're accessing their medical records, patient identification number. Good job, guys. Billy Rubin, protector from light, tests for jaundice, and a buildup in the liver. Good job. So we're looking for hormones, FSH and LH. Date and time of specimen collection. Good. Right, so the transporter is about to give it to the lab person, so they need to make sure they write their name on the form. So there's always got to be a chain of custody, you handing it off to them. But there's got to be proof that they received it. Okay. Yeah, that's high cholesterol right there. So anything above 200-ish, okay? Yep, print the labels out. It's always, I find it always confusing, but the cryo is actually kept warm. Okay, so remember that they're probably doing like a heel warmer kind of kit. Lactic acid needs to be refrigerated. Ooh, we were torn on that one, weren't we? 30 minutes. How many minutes do you allow the serum sample to stand before loading it in the centrifuge? 30 minutes. And why would you do that? Because if his body is 85, he is in bad shape, right? That urine should be body temperature. What information can the phlebotomist access in the lab information center? Previous lab results. Patient identification number. It should say 1 is missing a label. Yeah, sorry about that. It's typo. I'll fix that one. Yes, they have to go in a tamper evident container. .2. Okay, so this is an example. I'll hold off here now. This is from your NHA, and this is the NHA module that's on processing. Okay. Okay, I'll pause that. All right, so That is an NHA. I've got a few more. I've got, I'm going to start giving them to you guys because they are, I think I have everyone now on every module so that when we get closer to taking our first mock exam, we will have that to practice with. Okay, so what's left? We have another Kahoot that's due this weekend, right? We have module 6 that's due. We retook the test. I am giving you that opportunity. If you do want to do an assignment that you didn't do so well, I am going to give you another chance to resubmit that by Saturday. What that means though, is that's just because you did it already doesn't mean I'm just going to take those results. You have to redo whatever the assignment is all over again. So if you're going to do a module, you have to put another hour in, you got to do another quiz. If you're going to do the Kahoot, you need to get that score. If you did bad on test banks, you need to get that 90%, et cetera. Okay. I will take the highest grade. But that all has to be into me Saturday, 12 noon, if you're willing to do it. And again, I want you to make sure you email me with what you decide to do. So I know what you're doing. I may even have to get a new expiration date set up so that you can do those things. Monday quiz on chapters 16 and 17. I will upload our lecture for today so you can review that. And I think that's it. You guys have any questions?
Are we doing the post-lecture review quiz?
Oh, we are. I'm going to let you guys do that on your own. So I'll go ahead and give you that. Thank you. Very good. I've totally forgot about that. But that would have not been good on the grades, right? Okay, so our post review is going to be, let me find the, where did I do that? Oh, so it's you can do this on your own real quick if you want to. Go ahead and pull it up. It's 4 questions, guys. It'll take you 2 seconds. It is a capital P, a lowercase o, and a capital CT. Let's go ahead and get those submitted real quick. Good call, Sydney. Forgot.
What was the password again?
Okay, so it's a I just covered it up. Capital P, a lower O, capital CT. Does that work?
Yeah, it worked.
Okay. When you're done, you can log off, guys.